Thank you very much. I have just a little time to ask a very a final and very short question to Ms. Chunilall. You spoke about stigma. I'd like to ask you whether stigma within certain communities has been addressed through either the national framework or should be addressed in the action plan. And I'm talking about the South Asian community, where stigma is huge. It does not get talked about. It therefore may not well appear in the data. I'm not quite sure about that, but I do know it is an issue. What recommendations would you like to see in our report that would help these communities deal with reducing stigma and therefore eventually reducing suicide?
Thank you for that very important question. I would argue that there needs to be a shift in conversation. Speaking specifically to the South Asian community, I'm not 100% sure that we go home and talk about mental health, naming it mental health, mental illness, or naming it in a very diagnostic way or diagnostic language. And so, really meeting the community where they're at in terms of what are the words that they use to describe mental health, mental wellness, mental illness in their community. What are the words that they use when something is not going right and support is needed? I do think that there is value in really understanding the different cultures and giving some flexibility for folks within that culture to provide guidance into how mental health, mental illness, and suicide prevention can be better discussed at those tables. I do think that there's the South Asian community, and even there's a demarcation. The South Asian community that is in Canada, maybe second generation and third generation, but then there's the immigrant population, folks who are just coming into Canada and are fully prepared to work hard, to make it in this country, and really think about their mental health as the last piece that they think about. Self care is not something that's top of their mind. And so they don't even know the resources that exist in their community. There are great examples of organizations working in grassroots, like Soch Mental Health, that are really trying to raise the public awareness amongst the South Asian community. And I think we need to talk to more of those people.
Thank you very much. Witnesses, Ms. Chunilall and Ms. Fairman, you have helped us a great deal as we try and gather wisdom for our study. Thank you very much.